here for oversight on our city agencies as to how we are preparing for the coronavirus, for COVID-19, and to make sure that New Yorkers know exactly what precautions we're taking and how we're supporting the families of New York City. It's a very anxious time, and we want to make sure that New Yorkers feel informed and feel educated and know that regardless of their income, their immigration status, and they can walk into any public hospital and any hospital really and receive care and know exactly what to do to make sure that they feel good and that they practice safe flu habits in this season. I thought that sending a very sober message on expectations, on what we're doing, on what we've done, and what to expect going forward was really important for New Yorkers. I also thought that what we wanted to focus on was what were the proper health precautions, and that we do find a lot of the xenophobic rhetoric very, very disturbing. We wanted to move away from that. We wanted to make sure that people knew exactly what they could do to be safe and how our city agencies were working together to make sure that people knew what to do during this very anxious time, and that their city council people, that their elected officials were making sure that we were practicing proper oversight.
Good afternoon, everyone. I am City Council Speaker Corey Johnson, and I'd like to start off by thanking my colleagues, Council Members Levine and Rivera, for holding this joint hearing. Today, we'll discuss the city's preparedness for the novel coronavirus and the related disease officially designated COVID-19 by the World Health Organization, or the WHO. We expect to hear from Dr. Barbeau, the Commissioner of the Department of Health and Mental Hygiene. We have Dr. Mitchell Katz, the President and CEO of New York City Health and Hospitals. We have Richard Carranza, the Chancellor at the Department of Education. We have Andrew DeMora from the Office of Emergency Management, and members of the public. I am very thankful for the entire administration for being here today. I was just with you all at a press conference just 5 minutes ago at One Police Plaza. And for all of the work that you have been doing around the clock on this. I am pleased to know that it is an all-hands-on-deck approach to ensure that New Yorkers are as prepared, informed, and safe as possible. And I especially want to thank and recognize our Department of Health Commissioner, Dr. Barbeau, and her entire team at the New York City Health Department, who have been working tirelessly since the beginning of this year to ensure our city is prepared for and responsive to COVID-19. Dr. Barbeau, you've done a great job. The city of New York is lucky to have the best public health officials and health department in the world, and we appreciate you again taking time to come here, especially with everything that has been going on today. Recently, a new coronavirus, which causes a disease named COVID-19, has been detected in almost 100,000 people worldwide. COVID-19 has been making headlines, and there is a lot of misinformation out there. Today, we are here to shine light on the facts of what people need to know. We want New Yorkers to be prepared, and we want to address the real fears New Yorkers have, but we want New Yorkers to feel calm because the city is prepared. New York City has handled similar situations before, and we are ready to do it again. Coronaviruses are a family of viruses that cause mild illnesses, like a cold, to more serious illnesses, like different strains of the flu. I want to emphasize that COVID-19, for a large majority of people who become infected, presents the same symptoms as a cold or the flu. In fact, as of now, 80% of people with COVID-19 have mild symptoms that resolve on their own without the need for medical intervention. Based on our current understanding, most people who contract COVID-19 will not need hospital care or urgent medical care at all. That being said, we, as the public should see every single day, are taking this virus very seriously. And some New Yorkers are more vulnerable than others because new information is emerging every day. Today, again, we'll hear from the Department of Health and Mental Hygiene about individuals who may be more susceptible to moderate and severe symptoms, including older individuals and those with certain underlying health conditions, and what the city is doing to reach out and support these individuals. We all have a role to play in taking preventative measures to protect ourselves and our vulnerable friends and neighbors against this virus. Not surprisingly, these preventative measures are similar to those recommended for the common cold and the flu. Frequent and thorough hand washing with soap for at least 20 seconds, or using hand sanitizer when necessary, alcohol-based. Staying home if we feel sick, and covering our coughs and sneezes with a tissue or in our elbow. It is crucial for every single person who has a fever, cough, and or shortness of breath to contact their doctor or health provider or call 311 to get connected to care. There are also things that New Yorkers should not do at this time, such as boycotting or avoiding certain businesses, avoiding public spaces, hoarding important medical equipment, such as face masks or cleaning supplies. If they are healthy, this can hurt other New Yorkers who may actually need those supplies right now. New Yorkers can also rest assured knowing that every single person can receive medical care regardless of their insurance status, their income, or immigration status. If you are feeling unwell and you have any questions, again, you should call 311 and request that help. Anyone without health insurance can receive free and low-cost care at our public hospital system, and I'm glad that Dr. Katz is here as well. I want to encourage all New Yorkers to support their friends, neighbors, and colleagues by educating themselves against misinformation, especially misinformation that perpetuates panic or bias. In particular, we have seen examples of anti-Asian racism and anti-Semitism in connection with the spread of this virus. We as a city, as I've said before, will not stand for actions fueled by fear-mongering or racism. At moments like this, we must stand alongside our friends and neighbors and do all we can to protect one another. As a reminder, if you're being harassed due to your race, ethnicity, religion, nation of origin, or other identities, or you're a witness to such acts, you can report such discrimination and harassment to the New York City Commission on Human Rights by calling 311. I'm also troubled by some of the ways that we have seen, I think, irresponsible folks that have been commenting on this, who have perpetuated the troubling and fear-mongering messages and tried to create public panic around this when we're trying to handle this in a sober, factual, scientific way. Let's focus on public health. Let's make sure that our messaging resonates with the facts shared by true public health experts, such as members of our health department, of our health and hospital system, of the World Health Organization. That's who we should be listening to. Dr. Barbeau, how is COVID-19 spread?
So COVID-19 is what we call a respiratory virus, and it is a new strain within an existing family of viruses. And so the way that it is spread is when someone who has the virus and is infected with it coughs, sneezes to someone else, and that person then takes their hands, puts them in their mouth, puts them in their eyes, and that's where the virus comes into the body. This is not like measles, where if someone with the measles is in a room, leaves 2 hours later, 10 people who haven't been vaccinated with the measles come into the room, can actually get the measles very easily. 9 out of 10 of them will get it. This is a situation where an individual with coronavirus can spread the virus, but it is through very clear mechanisms that I just described.
Could you explain to us, as of today, what is the criteria for who could and who should be tested in New York City?
If an individual has traveled to any of the affected countries and are symptomatic, we want to test them. If someone has had contact with someone who is sick with COVID, obviously we want to test them. If someone is not feeling well and has concerns about that they might have come in contact with someone, we're now being that permissive as well. So the point here is that we have been pushing the federal government to loosen those restrictions, and I think now we're at a point where individuals who have concerns can call 311, they can call their doctor, they can go to an H&H facility, they can go to a number of different places around the city to have specimens collected. Those tests currently are done at the Public Health Laboratory. Our hope is that very soon H&H will be able to do those tests as well as commercial labs. So the testing capacity across the city will be increasing, hopefully very shortly.
If things changed a little bit and we saw a jump in infections here in New York City that required not just people quarantining in their home and staying in their home, but actually a significant number of older adults or people with chronic conditions actually needed to be hospitalized, you believe right now we have the capacity to deal with a situation like that?
Mitch Katz, CEO of Health and Hospitals, yes. Health and hospitals, as well as the private hospital systems, we practice specifically on what we would each do if 100 more people came to us. Every hospital, as part of its disaster plan, knows that they're going to activate their center of emergency, and there is a set protocol that all hospitals train on that begins with things like we're canceling elective surgeries, we're closing clinics for people who are not sick. All of the resources are moving into the hospital. Okay, do we have enough hospital beds? If we don't have enough hospital beds, what are the next spaces in the hospital that we would use? So we at Health and Hospitals, and I know in the greater New York voluntary sector as well, we actively practice how we're going to do that and are prepared.
I appreciate your office has sent a lot of guidance. If you could just walk us through, if a child in a classroom reports to his or her teacher that they don't feel well, what is the school supposed to do?
If a teacher notices that a student is sick, the teacher will tell the nurse or the principal that this student is presenting sick. The nurse or the designee, then, if the student is sick and complaining of a fever, a cough, or a shortness of breath, school staff should ask the student to put on a mask, and we have now provided masks to all of our schools. Call a parent for pickup and advise the parent to call a medical provider for instructions on the next step. The student will wait with an adult in a room with a door away from other students, so we segregate the student until the parent is able to come and pick up the student. The adult that waits with the student will also be provided a mask and stay at least 3 feet away from the child in the room, so we have some distancing, but they're still in the same room together. And then the nurse, and this is critically important, the nurse will inform the health director. And that's critically important because those health directors then are reporting to the Department of Health so that we have accurate information. The principal then will contact their superintendent and the borough office, and then we all will get additional guidance from the Department of Health from there. So it's a very clear protocol of what happens. The same thing, except we're not waiting for an adult, a parent, pertains to staff members. So if a staff member comes to school, presents ill, that person will check with the nurse, but then that person will be sent home with the same instructions. Contact your health provider and then get seen. And I think those are the DOE questions.
So for us, we do regular email blasts to a network of providers that includes tens of thousands of doctors in the city. And so we've mobilized that. And then specifically, we've also done, in collaboration with the state health department, webinars where doctors can call in, ask questions, learn the most up-to-date information, and be able to ask questions of experts. And so the last, I need somebody to get this for me. Thank you. The last webinar that we did, over 3,000 providers participated in the webinar, and so we have been providing patient education materials for them.
In different languages?
Patient education in different languages for them to post in their offices, yes.
A key additional resource for New Yorkers is 311, and 311 will triage the call if the person has no symptoms and is looking for testing. The call will be routed to the Department of Health. If the person has any symptoms, they'll be routed to Health and Hospitals, and we have live doctors and nurses who will take the call in real time, and because it's 311, there's excellent language capability to speak all of the languages of New York City.
Related to absences for this school year now, the mayor made an announcement yesterday. Can you just clarify exactly what the new announcement is?
So for the students that are in transition grades this year, transitioning into middle schools that have screens or high schools that have screens, their absence report is last year's absence. So they're okay. The question is, if God forbid, we have an increase and there's a lot of student absences, it's those students that next year will be applying to middle schools and high schools. The concern was, will the absences count against us next year? So what we have said is we have frozen all absences from the screening processes and the application processes. Students will be held harmless as it pertains to absences, as it pertains to application to school.
So fourth and seventh graders.
Correct.
Absences will not be counted against some coronavirus or not. Is that fair to say?
That's fair to say.
And that applies to the school year?
That's correct.
So for going back to pre-coronavirus.
So
is that fair?
whatever
The total measurement.
the total
yeah.
measurement is, that's being frozen.
And latenesses.
Beg your pardon?
Latenesses, some schools count latenesses. That will still continue to be a factor?
We'll get back to you specifically on that.
Okay.
Could you speak to measures that we are putting in place to protect our workforce, especially those in the critical areas I mentioned, and also to deal with what will be probably quite an increased burden of workload on those who are in critical job categories that are going to see increased work obligations considering this mounting crisis?
We need to maximize our workforce, and if they're coming back from areas where they could have potentially been affected, we don't want then that infection to potentially, there's always the small risk, being spread to others. Beyond that, as first responders, we want to make sure that if they are symptomatic but have not accessed care or have not been tested, that they don't then spread that to other individuals. And so that's a very critical part of what we're doing with regards to our preparedness and ensuring the safety of New Yorkers.
Who is making sure that the trains that are being cleaned are in fact being done equitably throughout a particular line, or all lines, I should say, so that it's not any one line that's being serviced more than any other line? Who's making sure that that happens? Because we know that Department of Transportation gives certain communities older buses, and there are other documented instances of inequities. So who's making sure that my community is getting their subways cleaned at the same rate as any other community?
The MTA said they're going to clean every subway car and station every 72 hours.
I ride the subway. Being within 2 seats of somebody is not, it's, you know, that's a lot of people. And the CDC's definition is close contact. So I just want to be clear. We're not talking about other end of the train. I'm talking about the person sitting next to me. If I sneeze and I'm infected, are Alika and Keith, you know, in close contact?
Would I be concerned about them spreading COVID-19 to me? No. If they sneezed on me,
Yeah.
yes. And I think that's because, this has been explained, it's a respiratory droplet.
The procedure when somebody walks into a hospital, do you give them a mask? Let's say I have flu symptoms. Do you?
Yes.
In the waiting room, I get a mask.
Correct.
Okay.
We've made sure at all our health and hospital facilities that right at registration, we can separate people who have respiratory illnesses. And as Dr. Barbeau said, most of them are not going to be COVID. Most of them are going to be influenza or other kinds of infectious respiratory viruses. We have actually sent out what we call secret shoppers, people who pose as patients to see how quick does the mask come out. You know, does the person go to a separate room? And when that's not noted, we immediately re-educate people, know if somebody comes with a respiratory symptom, here is what to do. And we practice that so that we are very good at that.
Are we likely to see in New York City an exponential curve?
China is now reporting decreasing,
Yes.
right? And why is that? That's because people are gaining immunity. They're being infected. They're either having no symptoms and developing immunity, or they're getting sick and developing immunity. And then once you have immunity, then you're not going to get it again.
Right. Okay. Thanks.
Thanks.
Are we in contact, we in New York City, with other health authorities outside United States to learn about the trend of viruses that affect certain people and to see if there's any modification in United States in order for us to work properly and to find the way to have a good vaccine?
Viruses mutate. Sometimes they mutate to become less serious and sometimes more serious. There's no evidence so far that this particular virus is mutating. Usually when viruses mutate, it's in response to treatment. They evolve usually to escape the treatment. And right now there isn't any treatment, so there's no real evolutionary pressure on the virus. So at least to date, that hasn't been an issue, but you're absolutely right to point out, and I think some of what scares people is when you have a new virus, you don't know its future, right? If you take a virus like measles, that's been around and we've understood it, you have a sense of what it does. I think that's part of what fuels it. I think on the testing, you have a very key issue, and as we've spoken, we hope that you'll join with us in advocating to the FDA and the CDC the need to speed up the approvals. There's the normal regulatory path, and then we're in the middle of a pandemic path, and that's supposed to be a different path. And this the testing that we're talking about, DNA testing, is not unique. We do this for a large variety of viruses. This is not brand new. They need to license it, and we very much appreciate the City Council's support on that.
We have some more great union folks that are going to testify. We have from SEIU 1199, Nadine Williamson. Is Nadine still here?
I am a member of 1199 SEIU. I work strictly with HIV patients. My patients are both young and old and are very frail. To keep them healthy as possible, we take precautions. We wear gloves and masks, and if needed, we also wear gowns. Masks and hand sanitizer dispensers are available at the visitor's desk, by the elevators, on all the floors, and in the patient's room. TCC is run by ArchCare. There are two things that are very important. One is that management makes sure that every worker gets trained on how to maintain a safe work environment, one where both the patients and the staff are safe, and they teach us that it is every staff member's responsibility to keep everyone safe. The other is that we have good benefits. If I am sick, I can call a doctor and I can get a doctor's note if I'm contagious and cannot go to work, so as not to risk anybody else from getting sick, and also my patients. I get a doctor's note and I can stay home until I get better. As healthcare workers, we know it is easy to spread colds, the flu, or a virus like the coronavirus. For the sake of every New Yorker's health, more needs to be done for people who do not have insurance and do not see a doctor in time to prevent spreading the virus, and for those who won't stay home because they are sick and afraid of losing their job. Thank you for this opportunity.
All the folks representing 1199, thank you, and thank you to all the members as well who play such a key and crucial role. From 32BJ, for the folks that you're representing here today, Mr. Bueno, you all, the union does a lot of things, but you also have school cleaners that are actually cleaning the schools, and you have folks that are handymen that are working inside the schools and in other facilities. So both of your unions are very, very key every single day, but especially as we talk about this issue.
I'm here to thank you for standing with airport workers in our fight for New York State Healthy Terminals Act to ensure that airport workers can access health insurance during this public health crisis. My colleagues and I serve, monitor, and protect New York's critical infrastructure, its airports. The Port Authority tells us that to protect them from security threats, airports need a stable and experienced workforce. Workers like myself and my colleagues who know the ins and outs of JFK and LaGuardia, this is the reason we go through such rigorous background checks before getting hired. It's the reason the Port Authority raised our minimum wage in 2018 to reduce turnover and to retain experienced workers like me. Getting that raise made a huge difference in my life, but it left out something important: health insurance. I do not qualify for Medicaid, but I cannot afford the insurance offered by my employer. So today, I'm uninsured.
Many workers do not get paid time off or have health benefits. So if they do not go to work, they do not get paid. They will sacrifice their health in order to pay rent and feed their families, meaning they'll go to work anyway knowing that they're sick, and it jeopardizes the lives of others. In case of an outbreak, they would be spreading the virus to everyone that they come in contact with. There must be a system available to all workers who might encounter this situation. If we're sick, we should not have to worry about paying our rent and providing for our families, financially or medically.
For those who are not insured, thank goodness we have our public hospitals, which will treat everybody, regardless of ability to pay, regardless of documentation status. So, and people who are unsure where to turn for free or affordable health care now can always call 311. They're set up to deal with coronavirus cases and others. But I do want to thank all of you for your service on the front lines. Thank you all for testifying. Thank you.
So I just want to thank you all for your testimony. I am very disturbed by the xenophobic rhetoric that is out there, and I'm very sorry that any New Yorker or person has to go through that experience when we should be focusing on how to properly prepare, right? How to make sure that we're taking public health precautions. And the point of our hearing today was to hear from the administration so you could officially know what they're doing to prepare, but also to just send a very sober message that we have to prepare for the worst case scenario and to make sure that we're doing our best compared to other cities who are going through similar experiences.